afternoon. The Secretary to the Government of the Federation, Honourable Ministers, Directors General, Directors here, ladies and gentlemen of the press. As of today, the 22nd of April 2020, 782 people, as of this morning, in 24 states and Federal Capital Territory have been confirmed to have the COVID-19 infection. The 117 new cases represent the highest daily increase in new cases so far and is one indication of more efficient testing and increasing community transmission. The most affected states are Lagos with 59, Federal Capital Territory with 29, Kano with 14, Borno with 6, Ogun with 3, Katsina 4, and 1 each, Bauchi, Rivers, and all the others. 25 deaths have sadly been recorded in total, and 197 people have been successfully treated for COVID-19 and discharged. With regard to Kano and the news around there, the Federal Ministry of Health, through the Chief Consultant Epidemiologist, has been with the Public Health Department of Kano State, and also 16 officers from NCDC were there to find out what was true about the news of burials going on there. They took place in the Gwale, Dala, Kombotso, Taraumi, Nasarawa, and the Kano municipal local governments. The state public health department is still looking into it to find out if these burials were out of normal, and they are carrying out further questioning of people to see what was peculiar about the story. Since there was no record and no test done of the deceased, the answer will come up in a few days' time when the epidemiologists bring their results. Yesterday, the 21st of April, the Ministry of Health convened the successful Emergency National Council on Health meeting via teleconference, where state commissioners of health and the acting FCT Secretary for Health were engaged to review the status and align all response to COVID-19 outbreak in the country. Some of the resolutions unanimously adopted are that all persons diagnosed with COVID-19 be henceforth preferably treated in the state where the diagnosis was made, rather than to be referred to another state or to their state of origin, except there is a medical indication for it. This is to avoid the high risk of exposure of other persons in the course of transfer. Patent and proprietary medicine vendors and pharmacists and chemists are henceforth prohibited from attempting to treat persons diagnosed with or suspected to be COVID-19 patients. Otherwise, their licenses may be cancelled. Private hospitals desiring to manage COVID-19 patients apply to their state ministries of health for the permit, and they must meet the standard IPC, infection prevention and control standards, and be accredited by a state accreditation team according to the guidelines developed by the Federal Ministry of Health before they are granted that permit. States will notify the Federal Ministry of Health of the isolation and treatment centers for inclusion on the COVID-19 Health Management Information System platform. This is for better coordination of national response. 27 rapid response teams are deployed to states by NCDC as at now to support the response, and the most recent ones are to Abia, Gombe, and Sokoto states. Active case finding is ongoing in communities with evidence of person-to-person transmission. This strategy requires more testing and diagnostics, and we are working to increase the capacity and activate additional laboratories, both public and private, for COVID-19 testing, with the final purpose of having one or more public health laboratory with PCR capability in every state. Citizens are reminded that COVID-19 has a recovery rate of over 90%. If those with the typical symptoms report early enough for testing and treatment or quarantine, it can save you from severe complications of the infection and also help to reduce the spread and save loved ones from getting infected. Everyone who has a symptom of that nature should call the Center of Nigeria Center for Disease Control or the state emergency number if you suspect yourself or anyone around you may have a COVID infection of that type. Again, because of the risks involved, those with existing medical conditions like diabetes, hypertension, kidney disease, TB, HIV, cancer, are advised to take special care and to obey the injunctions for preventing infection, because this group of people are known to be more vulnerable than others. To ensure best treatment options for Nigerians, a protocol for a patient ambulance transport system has been developed for FCT, and it is to be set up in all other states of the Federation. It is meant to smoothly convey patients to specialized treatment centers or between treatment centers as medically indicated. Nigeria Air Force and NEMA have also kindly put an aircraft on standby for use for this same purpose if need be. I want to applaud all the health workers in the front lines of the COVID-19 pandemic and urge them to take necessary precautions for their own safety. Some healthcare workers have already lost their lives in the less than 2 months since COVID-19 appeared, and many dozens, including doctors, are idling away in quarantine. Our health system cannot afford many more health workers being put out of service, and hence I once again appeal to all those who have the necessary information to give the information to healthcare workers, not to hide any information, not to mislead doctors or nurses, and to cooperate in the treatment that they are supposed to get. We must not underrate the infectious power of the coronavirus. I must stress the need again for sound knowledge of infection prevention and control protocol to be eligible for consideration to manage this infection. And I also remind health workers to be vigilant, to make sure that they protect themselves and not to take any risk in the line of duty. Again, as we have always said, we advise the use of tissue, handkerchief, when you are coughing or sneezing, or to sneeze or cough into your elbow to avoid spreading this infection to people around you. I also again remind all of our citizens to avoid mass gathering, to practice hand and respiratory hygiene and physical distancing, and to cancel all non-essential travel out of the place where you reside. This is not a time to go outside the safety of your home. And remember also to wash and sun dry or iron your reusable cloth mask, or if you are using a face covering, attend to it every day. Stay home and take all precautions carefully.